Welcome to the Wolfpack Fitness Podcast. I'm your host, Adrian Wolf. I'm a fitness coach and PhD student in interdisciplinary health sciences at the University of Nevada, Las Vegas. For today's episode, I had Dr. Cailin Mitchell on, and she's a physical therapist here in Las Vegas, and she is the owner of Onward Physical Therapy. We had a really fun conversation. We talked a lot about prehab, rehab, how you can minimize injury risk, and how she uses specific exercise programming after she helps her clients get out of pain and stay out of pain for the long term. Also, we talked a lot about the pelvic floor and pelvic floor dysfunction and how that's important for not just women, but also men. So I wanted to mention that it's always important to work with a pelvic floor physical therapist for guidance on this topic. Prior to getting into the episode, I want to make it known that this podcast is separate from my teaching and research roles at the University of Nevada, Las Vegas. Enjoy the episode. What's going on, Wolfpack? Welcome to episode 20. Today's guest is Cailin Mitchell. Cailin is a doctor of physical therapy, certified strength and conditioning specialist, residency trained and board certified orthopedic clinical specialist, certified pelvic specialist, and owner of Onward Physical Therapy in North Las Vegas, where she helps active adults hurt less and get hurt less. And I'm honored to have her on the show today. Welcome.
Thank you. Thanks for having me.
Of course. So for the listeners, Cailin and I met actually a couple months ago at Camp Rhino Northwest, if you're familiar with that gym. If not, you should definitely go check it out. They have awesome coaches there, awesome classes. But we're working out together. We didn't really talk very much, but more recently we were at Camp Rhino Southeast, which is the other family of Camp Rhino gyms down in the south, and we kind of had a little bit more of an extensive conversation. So I thought she'd be an awesome person to have on the podcast with all her unique specialties. So that's why I wanted to have her on today. So Cailin, I want to give you a little bit of a chance to talk about your history and how you decided to become a physical therapist, what your path was like, maybe a little bit about your career as a college tennis player as well. Maybe that fed into it a little bit also. So I'll kind of let you take it away.
Yeah, absolutely. I feel like pretty classic physical therapy origin stories. Was very involved in athletics from a young age. Love the health and fitness side of just growing up being active. But didn't know if it was for sure a career path for me. So I tried out a few different things. I was coaching tennis for a little bit, worked at a gym for a little bit, trying to find, okay, am I wanting health and fitness to be a career? Or is this just something kind of for me on the side as a hobby or way to stay healthy? And then finally did my first volunteering at a physical therapy clinic and just absolutely fell in love with how you could use exercise prescription and kind of hands-on stuff to really change and enhance people's life. And I'm biased, but I think it's the coolest job in the world. So never, never looked
I,
back after that moment, little taste of it. And I was like, oh, this is it. This is the coolest.
Getting people out of pain is really cool, but also keeping them out of pain is even better. So,
Yep.
yeah. hmm
100%.
Okay. So you did a couple internships there. It seemed like, so you said you worked at a couple gyms as well. Did you do personal training or group fitness classes or anything, or were you always kind of like hanging around the physical therapists?
Yeah, so I was front desk gearing up to be more personal trainer. Was definitely more the sales aspect side of things that I was like, oh, this isn't my favorite thing in the world. Didn't really meet the mark, I feel like, of where I was hoping to impact people's life. More of kind of globo gym vibes of let's get people in the door and just
Yeah.
kind of get them through. But yeah, it was a good taste in kind of seeing a lot of different fitness levels. So a very cool experience nonetheless. But yeah, kind of a
Okay.
stepping stone on the way for sure.
Okay. Now you earned your Bachelor of Science at uh, what was it?
Cal State Fullerton.
Cal State Fullerton. Right. Exactly. Sorry about that.
Oh no, it's okay.
But yeah. So were you working in gyms throughout that time while you were trying to figure things out with kinesiology, or where was that along the way?
Yep, exactly. So I had ended my college tennis career my sophomore year. I was playing for the junior college there at the time. Strained my calf pretty good at the peak of my
Ooh.
last season. Yeah, I was playing out of my mind, was doing great. Got a nice grade 2 strain of my calf halfway
Oh,
through, like exactly the halfway point. Um, Realized that there was maybe a little more of life outside of just playing tennis, which was a nice kind of blessing in disguise there. Didn't lead me directly to the physical therapy route. I was just kind of rehabbing it myself, but realized after that point that's kind of where I switched my major to kinesiology and was like, okay, I think there's more to explore here for sure. Part of that was when I started coaching tennis and then working at gyms as well, just kind of exploring the options. But like I said,
hmm.
nothing really stuck out until I finally got my foot in my first clinical experience. And I was like, oh, this is where the magic is happening for sure.
Gotcha. And when did you get that first clinical experience?
That was back in, it would have been 14, 2014 or 2015.
Mm.
It was actually kind of a unique startup. My friend and I were backpacking through Europe, and there was a volunteer opportunity in Romania to
Wow.
work in a specialized physical therapy clinic there.
Wow.
Yeah, and they were working with, it was a pediatrics clinic, and it was very bare bones. But the physical therapist I was working with was super about it, so passionate. And like I said, once you see how exercise interventions and kind of some hands-on stuff can change people's pain levels and change kind of how they interact with their bodies and the world around them. Yeah, way cool.
Hmm. So let's kind of go that way then,
Yeah.
because I'm interested in knowing how physical therapy or their approach abroad differs from what you see in the US. So maybe let's talk about that a little bit.
Yeah, very different. And I wish I had the perspective that I have now as a physical therapist, since I was going in with the lens of kind of that was my first taste of physical therapy at all. Hard for me to look back and really compare, versus if I went in knowing what I know now, kind of. But like I said, very bare bones. Like they didn't even have a treatment table. They had a mat on a floor in a room, and then
Mm.
a little bit of one of those Jacob's ladder, like a stretching ladder, couple exercise balls, and a couple rubber bands, and that was
Wow.
it. Yeah,
Wow. Okay.
yeah.
All right. So very, very basic.
Very basic.
All
Yeah,
right.
very bare
Okay.
bones.
All right. Then you came back to the States and that's where you started your path towards being a doctor of physical therapy.
Yep, you got it.
And
So,
where'd you complete that?
UNLV.
Okay, gotcha.
So,
Along with
yep,
Cameron. Hmm.
yep, exactly.
Okay.
Finished my undergrad, geared up all the nice prereqs towards getting into PT school, and then yeah, full steam ahead at that point.
Okay. And when did you
Yeah,
finish that up? What year?
2021, I graduated from PT school.
Okay. All right. So, did you have your eyes on Onward at that point, or when did Onward come about? I guess in your career.
Yeah, so I did not. I wanted to go into some sort of federal work. So I was looking at either active duty into like a military-based PT options or the VA, just
Hmm.
because through school and kind of hearing people's experiences, that was where a lot of the one-on-one treatment was able to happen. And you got to kind of expand your expertise and really work within the reins of the whole degree of physical therapy, versus kind of the constraints of insurance-based model.
Yeah.
So I did a residency after graduation in a VA in Durham, North Carolina that had a little bit of a experience at Fort Bragg, so the active duty military there, Army,
Hmm.
just
Okay.
to kind of get sample it a little bit before I committed for completely. And it was and wasn't what I expected. So started trying to explore some other ways. I was always trying to find like what I imagined physical therapy could be, and I kind of wasn't finding it with all the direct options of jobs and options around me. And I was like, this has to exist. I can't be the only one
Hmm.
knowing kind of what I would imagine this looking like. Like this can't be a one-off thought. There has to be other people wanting and practicing this way. And that's when I found it's called the or Institute of Clinical Excellence. It's a continuing education program, actually, where they were kind of preaching exactly what I imagine physical therapy to be. So combining some of the manual work with some of the exercise model, looking at the holistic approach and the long term of what physical therapy can be for people and not just these quick fixes. And within that, they open these chain of out of network practices for people who, like me, were hoping to be able to treat how we want to treat and really maximize what a physical therapist can be for people. And so that's where I found that this existed. And through their continuing education, just taking more of their courses, um, yeah, realized this was it. This was the way for
Mm-hmm.
sure.
Okay, gotcha. And then all roads lead back to Vegas, right?
Yeah.
Okay, so you completed your training with ICE, and then so were you still in Durham during that time, or had you moved back to Las Vegas already, or where was that?
Yeah, so I had finished my residency. I was actually just kind of consuming all of their podcasts and online resources through it at that point. Once I came back to Vegas, I really kind of full-fledged went into, okay, there's got to be some better options here. But that's when we took our first in-person course from them. And
Mm,
then from that point on, we were immediately learning of, okay, how do we open this thing in Vegas and bring the good stuff to the town for sure.
awesome. Okay, so when
Yeah.
did you guys actually officially open Onward?
We officially opened February of this year.
All right, and things
Yeah.
are rocking and rolling over there, huh?
Things are rocking and rolling. It's been good. It's been
Okay.
great.
Awesome. Awesome
Yeah.
stuff. Yeah. Yeah. I've seen footage of your guys' gym and everything, and it looks like you got a really cool space there.
Thanks.
Um,
Appreciate it.
so
We like it.
yeah, yeah, I bet. Got a really cool logo there too behind you.
Yeah.
So
Thanks.
yeah.
Yep.
Yep. All right. So let's dive into the business a little bit more and your kind of business model and your approach to physical therapy because I want to learn more from the
Absolutely.
traditional to what you had imagined physical therapy to be, and you're seems like you're living it right now. Um, so I was looking through the page a little bit on Instagram, and I noticed a couple words that stood out to me. Fitness forward. You guys are fitness forward clinicians. So I want you to talk about that a little bit and what that kind of means. Help the listeners understand how fitness forward is different from your traditional physical therapy model.
Absolutely. So I think there's a two-tiered kind of answer to it. One, in the broad sense, fitness forward, meaning just as a society, no one's dying from back pain, essentially. No one's dying from, oh, my hip kind of hurts today. But people are dying from inactivity and all these metabolic diseases that really add up over time and are such the large disability in this society. So our fitness forward approach, meaning we're either coming alongside people to keep people active in what they love to do, and have been doing for that big overreaching exercise, fitness, health in their life, or coming alongside people who maybe have had barriers to exercise and fitness for the long term and being able to kind of open that door and get them on a long term strategy.
Mm,
Because health and fitness, I mean, that's everything in life. So that's kind of the overall, I would say, fitness forward approach, kind of as a goal base for our model. But also meaning when you come here, we're not just focused on the manual therapy work. We think that's important, and it's really nice to be able to get people out of pain quickly. But it's following up with, okay, what's going to keep people out of pain for the long term or getting
mm,
them back to what they want to do? It has to go beyond people just laying on a manual treatment table and us giving the modalities or the manual therapy. Those are all the short term kind of solutions to it. So that second part of that fitness forward is giving people the tools of making it last for the long term.
excellent. Yeah, helping them be self-sufficient, right? Um,
100%.
yeah, but that's one of those things with the traditional physical therapy model is, all right, just getting the person out of pain, right? There's very little that has to do with actual function of muscles, restoring muscle balance, teaching people what to do when they get out of the clinic. So, and I want to hit on something you said as well was people aren't dying from back pain. However, I think somebody can argue that they indirectly are dying from back pain indirectly or
Yeah.
any other pain they might have that they can't manage, that eventually they need surgery for, that they can potentially start becoming frail from. And frailty is extremely dangerous. You start to lose muscle, you start to lose function. So that's really like the beginning stages of possibly premature mortality, right? If we're really getting down into it. So, I think that's super important what you guys are doing in that respect. So being able to recognize that for the clients coming in, and then I'm assuming education is a big part of what you guys do as well. When you're working alongside your clients, you're also educating them, correct?
Yeah, absolutely. And that's a huge other benefit of being outside of the insurance based model. With insurance kind of dictating what's reimbursed, the physical therapist usually has very little time with the individual. Here we get one on one with an hour for each person, where we get to actually dive into more of those holistic approaches too and look at the full body, like nutrition, recovery, sleep, all of these big pillar
Wow. Okay.
items. Yeah, that make a huge difference in people's pain and what they may be coming in for, like an orthopedic thing happening. But there's all these kind of big ticket items that typically get missed in a physical therapy clinic just because there's time constraints. So you have to prioritize, okay, what am I going to do with this person for 20 minutes? And
Mhm.
oftentimes the education components gets missed for sure.
Definitely. So you mentioned nutrition and recovery as well as being aspects of your practice. Tell me and the listeners a little bit more about that, what you guys do with nutrition and recovery. Because if I am a client coming in for physical therapy and I know nothing about what I'm getting into, the last thing I'm really thinking of is, hey, I'm going to go to a physical therapy clinic and get nutrition and recovery counseling as well. So let's talk about that a little bit.
Yeah. And it really depends, I would say, on what someone is coming in for and where we are in their treatment. So if someone's coming in with like an acute injury, we're not going back and being like, okay, here's 10 other ways that you should have prevented this to happen. But it usually becomes a bigger part of the conversation for sure at some point, just depending when that is in someone's treatment plan. But oftentimes it's a lot of talk of kind of hydration levels, which play a big role in inflammation, nutrition with just kind of the basics of the building blocks of, okay, calories in, out, protein intake, kind of those inflammatory food lists, depending on the person's presentation. Sometimes those overtraining injuries or an underfueling injury. And especially for me, I work with a lot of pregnancy or postpartum women who might not understand just how much of a caloric intake they need to be getting to fuel their body.
Hmm.
So we could be talking pelvic floor issues, which is a group of muscles just like anything else. And that leads us into, okay, maybe we need to talk about what our fuel looks like, how much protein we're getting in. So it's kind of woven in most people's, I would say, treatment plan at one time or another, talking of those other ways that we could be supplementing what we're doing in the clinic.
Hmm. Definitely. And nutrition is one of those aspects that can help speed recovery from an injury, but also minimize your risk of sustaining one as well. So it's something that a lot of people don't connect the dots with, but the fact that you guys are integrating it into your approach is absolutely awesome. So commend you guys for that. Nice job.
Yeah, thank you.
Yeah.
Again, it's just one of those aspects that I think a lot of physical therapists, we have that in our scope of practice to be able to work with people on, but we just underutilize it because we don't have that time and ability
Right.
to focus. So it's super awesome to be able to include that for,
Hmm.
again, more of the long-term piece for people.
Yeah, definitely. And I always found it challenging as a so still do some personal training uh, on the side while I'm in school at UNLV, but throughout my time training people, I always have a difficult time to squeeze in some sort of nutritional education in there because I'm always focused on the movement quality or what we're doing next, making sure they're doing this correctly. So it is difficult to kind of squeeze that in with them. So how would you what's an example of maybe a practical example of how you would squeeze in some sort of nutritional education with a client that you're currently working with?
Yeah, so I would say even going back to kind of my pregnancy or postpartum examples of, especially postpartum and breastfeeding, if we are experiencing some pelvic floor disorder where we're getting some leakage, we're talking about the physical aspects of that, the coordination of some muscles, but also especially for like a postpartum mom, last thing what they want to do is like track full calories. So
Mhm.
I'll even tell people like, hey, snap a shot like picture of what you're eating throughout the day, bring it in next time, and we're going to do a rough estimate of maybe how many calories and how much protein it's we're averaging and kind of looking at a normal day. So kind of hitting those topics in the realm of, okay, what are we treating you for? Looking at a snapshot of where we can maybe make some changes there. If it's beyond kind of, okay, something we can integrate in our practice, or they have some other like weight loss goals that seem to be beyond what we could cover in the scope of interacting with us, we do have our kind of preferred partners that we could outreach for as well. So it's not like we're trying to shortchange the nutritionists out there, but I would say there's definitely good examples of where it integrates really well into the physical side of things that we're working on for sure.
Awesome. Okay, so I do want to get into the pelvic floor, specifically dysfunction, a little bit more, because that's your specialty. I do want to kind of save that towards the end a little bit, but I do want to get into a couple things I was interested about as well, specifically treatment approaches. So, say somebody comes to you for pain, um, whether it's pelvic floor or they have knee pain or shoulder pain, whatever it might be. I was looking at the website, and one of the things that you guys specialize in is something called myofascial decompression. So those are big words for the listeners, right? So let's maybe break those down a little bit and help the listeners understand what exactly that means and how you would apply that sort of technique for any hypothetical situation, shoulder, hip, knee, whatever.
Absolutely. So, myofascial decompression, essentially broken down the words itself, is talking about the lining that surrounds all our muscle called fascia. It's a connective tissue in the body. It's innervated, meaning it could feel pain, but not innervated with motor nerves. So we're not controlling it. It's not contractile tissue. It's kind of the skin that's on the inside around the muscles. Oftentimes gets used as part of the treatment plan to see if we can get some better movement quality in a muscle or surrounding tissue. And the way we like to do it is through cupping. So people are usually are familiar with seeing the big circle marks on people. It's a way to kind of lift that surface level skin, get some movement under it. I always explain it along with a lot of our manual techniques is we're trying to get a little more fluid exchange through that area, getting a little relaxation through that area, kind of reminding the body at the tissue level, but also kind of that mind body connection of, okay, this area can move and glide and things are okay, it's safe. So we get some tissue level extra movement, but also some just kind of mind body connection, relaxation through it too, which helps us to get a little more movement in the area or maybe get a little less pain in the area to start some of those again reinforcing exercises or movements to make it last a little longer as well.
Gotcha. So your cupping therapy, that is the primary, I guess, method of this myofascial decompression that you guys do.
Yeah, so we like it because most of the other manual techniques, there's a lot of pressure kind of being put into the system, or our other kind of preferred manual. We love dry needling for people. Again, kind of just taking away the pressure component of some manual work, but the cupping's nice because it's our only strategy that kind of lifts the skin off. So it's just a different feel and definitely a different intervention for people who are feeling like their tissue's just kind of stuck.
Yeah. And how does that differ from body tempering? Help the listeners understand what body tempering is.
Yeah, so body tempering is more of that compressive manual therapy. It's what most manual therapy kind of is, where you're either getting like deep tissue massage, usually with tools where you're getting some pressure through the idea is you're trying to kind of break what people consider like the adhesions down in the body. Um, I say it in quotes because a lot of manual stuff, people like to kind of market as these magic fixes, and we're changing some tissues that maybe don't change as dramatically as we like them to. But again, kind of just getting some fluid through the area, getting things to relax at both tissue and mind level. But yeah, tempering is more of that deep pressure manual work with the tool.
And when you say tissue and mind level, so my head goes to is there a connection between sustained pressure into this tissue, this fascia, this muscle, and the ability for the nervous system to relax its output to that muscle? Is that also a little bit of how body tempering works rather than just breaking up tissue adhesions?
Yeah, absolutely that component too. So kind of those sensory systems in the muscles with the deep pressure absolutely gives a signal of, okay, we can relax at this area.
hmm Yeah, so I feel like that's um, what a lot of people don't necessarily think about is that connection between the brain and the muscle. And there's a lot more going on typically when you're applying that type of technique rather than just breaking up stiff tissue. I mean, obviously you are, but I just think it's incredibly fascinating how the brain is involved and how you can get the brain and the drive from the brain to simply relax just by applying pressure into the tissues. So I
Yeah,
think that's really cool.
yeah, for sure. Yeah, and
And
anyone who's kind of experienced
mhm,
that where you kind of let the muscle melt away, definitely a lot of that brain body connection that's involved for that for sure.
mhm. Gotcha. And one more question about cupping therapy. Is there a specific area on the body that is a little bit more effective for the use of cupping therapy? Or where I see it a lot on the back, around the shoulder, but can it be done elsewhere? Yeah.
Yeah, absolutely. So, I mean, technically, it can be done most everywhere, except for places. I was gonna say except for more sensitive areas, but I've even seen cupping strategies there. So I don't know if there's things that can't be cupped. I typically use cupping for more widespread areas or elongated muscles. So I really like the
Mhm,
back because we get kind of all our spinal extensors that go from our tailbone up to our neck. So it's a nice way to kind of lift that skin over that portion and get a lot of bang for our buck out of a stretch because of it. But yeah, I think it differs a lot depending on people's technique and what you're using it for. I really like using it for kind of larger areas. That way we can kind of get, like I said, those larger muscles moving a little easier.
Gotcha. Well, I think my spinal erectors have been overactive for way too long. I can always see that imbalance. Like my upper back muscles are not as developed, and the spinal erectors sometimes take over, specifically with deadlifting or any posterior chain exercises. So that's something I might try to maybe need to do.
Yeah, for sure. You'll have to
Yeah.
come in. We'll give it a go.
All right. So next is this might be a difficult question. I can't imagine anybody's asked you this before, but I'm
Uh,
going to give it a go. All right. Is there a link between psychological trauma like anxiety and depression and those types of mental health conditions and myofascial stiffness? Do you know anything about that or in the research about that potentially? Because I know I'm speaking from my own experience. All right. I'm a high anxiety person. I tend to get very tense and stiff a lot. I make progress doing mobility techniques, stretching, all that stuff, but it tends to go away very, very quickly. I tend to wake up in the morning feeling like I'm starting back from square one. I'm sure a lot of other people are as well. And so naturally, I like to ask the question: is there a connection there? Have you heard of anything like that?
I would say I am not well aware of specifically myofascial stiffness. If there's a direct correlation. There is for sure a direct correlation with pain and an area called central sensitization of pain, where we have a little more heightened awareness of sensations and pain experience. And that definitely goes hand in hand with those symptoms of anxiety, depression, stress levels, going back to our sleep, nutrition, hydration. Those are all big pillars of if our nervous system is ramped up all of the time, we experience sensations and pain a little differently. And that's definitely been proven time and time
Hmm.
again in literature. So going hand in hand, I think that's not a stretch to say, yeah, that myofascial stiffness or feeling like you're starting at square one, probably definitely a result of living in that nervous system just kind of at that high alert, not letting all those systems relax for sure.
Right. And the two are probably interrelated in the opposite direction as well, because I've noticed specifically with myself, whenever I do self myofascial release, static stretching with slow breathing, just easing the nervous system, easing the muscles, that nearly automatically like helps my mind calm down. Like the thoughts aren't racing as much. I don't feel as anxious. I don't feel as stressed. So I just think it's a very fascinating connection, and probably a question I will keep on asking more and more people as I have them on the podcast. So, but that term you used, nervous system hypersensitization, that is definitely a thing, because I've come across that in my research a lot. And it's basically when your nervous system is in a heightened state, you perceive regular stimuli. Like if I were to like say, I don't know, touch my hand, for example, the nervous system sometimes may be in overdrive, and I might perceive that as a painful stimulus rather than just, hey, it's regular pressure or a touch. So I just thought it was very interesting. So
Yeah, it's a
mhm.
fascinating world for sure.
Yeah.
But definitely the ties of kind of how the overall system is operating and how that presents as kind of orthopedic injuries or concern, definitely you're knocking it away from those ties for sure. It's always connected.
Yeah, definitely. All right, so let's get into the pelvic floor now a little bit.
All
All
right.
right, so very, very fascinating. So I know, so I'm assuming most of your clients that come to you come for some sort of pelvic floor dysfunction. Is that correct?
I would say I see a mixed. So right now I probably have a third maybe of my caseload or pure pelvic floor specific concerns. But I definitely love dabbling in both worlds. And sometimes people coming in for what they think is an orthopedic concern of like hip or low back pain ends up tying back to the pelvic floor world.
Interesting.
Yeah.
Okay. Okay. Let's talk about that a little bit. How do those
Yeah.
two tie in?
Yeah. So our pelvic floor muscles are part of our core. And when we say core, a lot of people think kind of our abs in the front, but
Yes.
really our core is kind of our whole 360 trunk. So it's our ribs, our diaphragm, it's our abdominal muscles that wrap all the way around. It's our back muscles, talk about the extensors, but those deeper back muscles as well, and our spine. But the bottom of that core canister is our pelvic floor for both male and females, which is also sometimes shocking to some men out there of,
Yeah,
wait, what?
yeah. That's what I want to get into as well. So, but I'm gonna
Yeah.
let you keep going.
Yeah. So when our pressure management system is off, oftentimes females get pelvic floor dysfunction because it potentially is the weakest chain in that kind of cylinder.
Mm,
But we could also get some other core related dysfunctions of back pain, not managing those pressures properly, or kind of overworking to take up some of the slack of the others. But our pelvic floor muscles also are closely related to our hip muscles. So sometimes we get some hip pain, kind of those vague back SI joint pains that have a big tie into some of those pelvic floor muscles, either maybe similar to all our other muscles we treat, maybe being a little cranky, a little sore, or just underworked or overworked. So
mm.
getting in a good pelvic floor evaluation, if especially when people haven't had real success with treating directly the low back or hip, or just when we get them in person, sometimes that presentation screams, hey, we got to check out the pelvic floor. And it's that
Mm.
missing link for a lot of people, which is super fun and one of my favorite parts of being in both worlds for sure.
Yeah, it's a big puzzle, I can imagine. So,
Yeah.
you mentioned those muscles being either underworked or overworked. Which one is more common?
Surprisingly, I would say kind of overactive pelvic floor muscles is a big
Mm.
culprit. I see a lot of CrossFit athletes or just athletic females as well that have some urinary incontinence problems, or like I said, some of that back pain, hip pain. We're really never told what to do with our pelvic floor, I would say, as females, but males too. And oftentimes, if someone's had an experience of leakage or if they've looked online and they've been told to Kegel for everything, people are just constantly squeezing their pelvic floor without even realizing it.
Mm-hmm.
And just like every other muscle, I like to think back to like the upper trap. If you've ever been told by like a yoga instructor or maybe a PT, hey, relax your shoulders, and you're like, oh my gosh, I didn't even know my shoulders were like up at my ears.
Yep.
Same thing happens at the pelvic floor where you're like, okay, relax your pelvic floor. And they're like, is it not relaxed? And it's just full.
Yeah. So how do you get your pelvic floor to relax?
Yeah.
If you have no idea, say the muscles are indeed overactive. Do you do that through breathing? Is there some reverse muscle exercise that you can do that you can describe? And then I'll link to it in the show notes after this as well. So if you have video exercise demo as well, that would be helpful.
Yeah, so a few different techniques. Definitely breathing is a big part of it. One, because our diaphragm and ribs are part of that core canister as well. So when we're talking, especially early on, of what should be engaged, what should be relaxed at what times, breathing is a nice way to coordinate all of those pieces together. So as you inhale, the whole core is kind of like a balloon that inflates. So, including our pelvic floor should be able to relax and expand down. So, that's
Hmm.
sometimes enough of a cue for people to be aware of what their pelvic floor is doing. I really like combining that with some pelvic floor lengthening stretches. Things like child's pose is a nice, easy way to be able to let those muscles relax, have
Hmm.
gravity help them go to that relaxing
Okay.
position.
I wouldn't think about that
Yeah,
for child's pose because I usually feel it mostly in my lats and my back and my chest. Um, but yeah, it does stretch out the glutes as well. But I never
yeah.
thought of the deeper pelvic floor muscles being involved with that as well. So okay.
Yeah, that one, especially if you have the mobility for it, if you're fighting yourself to get your hips onto your heels, maybe not the most relaxing for your pelvic floor. But like happy baby as another yoga
Mm,
position if you're familiar,
okay.
or just yeah, external cues sometimes help as well. So kind of sitting on like a ball or a rolled up towel and kind of having that tactile, okay, I'm closer to the towel, I'm further away from the towel.
Hmm.
And then kind of like you were saying, that kind of reverse muscle action, if you give a good squeeze and then let it relax from there, sometimes we get to
Mm.
the point of, okay, this is what contracted feels like. This is what relaxing feels like
Okay.
too.
So that's somewhat of a PNF stretching technique, right? And for the
Yeah.
listeners, PNF means proprioceptive neuromuscular facilitation. Very long words right there, but exactly what Kaylin said is you're squeezing the muscle very, very tight, and what that does, it creates a certain amount of tension within the tendons of the muscle, and those tendons have receptors within them that basically signal to the brain, hey, we're at max tension. We need to relax so we don't hurt ourselves. So whenever we relax after that, there's like a very deep relaxation response from the muscles afterwards. So would you agree with that?
100%. Yeah. Great explanation of it.
Awesome. Okay. So that's very helpful to do those couple stretches right there. So let's talk real quick the difference between women and men. All right. So I can imagine men do not like talking about the pelvic floor. It's an uncomfortable conversation. However, I feel like it can be important, and I feel like a lot of pelvic floor issues, maybe overactive pelvic floor, go untreated or unreported. They don't even want to think about the fact that it could be an issue. So maybe talk about that a little bit to help men out there understand that it might be an issue.
Yeah, absolutely. So I think there's still a lot of lack of education out there for pelvic floor issues in general. I think there's been a bigger push of getting it out for women, especially pregnancy and postpartum. It's now more of a conversation, but definitely still lacking for men and interventions for men, but also just awareness of pelvic floor issues may look different in men than women
Hmm.
because of our anatomy. Pelvic floor issues in women, it's mostly that urinary incontinence. I shouldn't say mostly, but that's usually the one that cues people in the most of, okay, yeah, this is probably a
Hmm.
pelvic floor issue. For men, that's less of a problem because urethra is longer, so it's not kind of the first thing that is giving the signal, hey, the pelvic floor is dysfunctional.
Hmm.
But even things, especially with like lifters, with like gas incontinence or like fecal incontinence, which again, not the most talked about thing in
Hmm.
a gym room, but
Yeah.
those are signs for sure that there is some either pressure management dysfunction, and often tying that into that pelvic floor disorder as well.
Okay. When you say fecal incontinence, you mean constipation?
Could be constipation, but both ends of that too. So,
Hmm.
um, males and females experience some like bowel incontinence with lifting or just kind of throughout their day to day, where we're lacking some of that tone and maybe not realizing why, oh, we're leaking some bowel while we're doing different moves or things. But yeah, other end of that spectrum is incontinence as well, which is a topic that we end up working with for pelvic floor.
Hmm. Okay. Very interesting. So, listeners, yeah, you heard it. If you have a pelvic floor issue that's not addressed, that could feed into lower back pain. It could feed into hip pain. Can potentially even feed into knee pain, I guess, up and down the chain, because everything is connected. That's really good for the listeners to know. So I will definitely link those couple stretches, and I'll talk to you, Cailin, after this as well. If there are any more video exercise demos you want to include in that as well, that could be helpful for people to start working on.
Yeah, absolutely.
Awesome. Okay, so the next thing I want to get into, and we're kind of nearing the end here a little bit, but let's talk about after treatment. So, say someone comes to you for either pelvic floor dysfunction issue or knee issue, whatever joint issue they're having. You get them rocking and rolling again. They're pain free. They have some function. Let's talk a little bit more about your exercise programming, because the treatment doesn't necessarily stop there, right? You want to continue working with them for at least a certain amount of time to make sure they go home. And like I said in the beginning of the episode, they're self sufficient to some extent and they don't forget all this stuff. They continue to do it, this strength training, for themselves. So, what might that look like for somebody after you get them out of pain?
Yeah, absolutely. And it kind of differs, of course, based on the person, what their goals are, and what kind of activities they're into or getting into. We have a program called Restore and Perform where it's set up for that long-term maintenance for people. It's an option. We have a once a month or twice a month membership based treatment plan where people are coming in either for more of that check in of manual therapy work, revising some of the stuff they're doing on their own, maybe checking in of newer injuries as they crop up too.
Hmm.
But for a lot of people, that also is a good time to be able to tailor some in person exercise. So some of our sessions look more like personal training sessions than a traditional PT model. And for others, we're spending maybe a little bit more time on some manual work because they're able to keep up on all their exercise end of things on the outside of the clinic. And they're just really needing us for a little bit of maintenance work when they come
Hmm.
in for some of those newer aches or pains that are cropping up.
Gotcha. Okay, very good. And is there ever a time where someone might want to come in that, say, they're not experiencing any pain, they're functioning pretty well? Um, what would be some signs, I guess, that they might need to come in and see you guys, maybe for some treatment, even though that there's nothing going on? They might feel everything's okay.
Yeah, that's a great question. We, because of our model, get to see people not with a diagnosed pain, which is awesome. So we have a couple people on our schedules right now where they know they're ramping up some training programs. A lot of runners, especially if there's like a race upcoming and they just want a little bit of guided recovery work or some of that screening of injury prevention component of it of, hey, I'm about to ramp up some mileage or I'm about to ramp up my training and they know, hey, that's going to stress my body out a
Mm,
little bit. And sometimes they either need guidance with what that progression might look like, or they just know, hey, when I'm starting to ramp this up, like these are my usual areas of concern. Can we do some kind of prehab for these areas or get started on more of that maintenance body work kind of goals?
Okay. So you mentioned runners, but there other specific types of athletes that you guys work with?
Yeah, I would say, I mean, we really see everyone. We like saying we see active adults, but as I mentioned, sometimes that's people who have had barriers of entry to a solid exercise routine. So we see a lot of recreational athletes either picking up a sport like running or those kind of team events like softball on the weekends, or people who are just active in a gym routine, or people who are wanting to start on a gym routine as well. We love coming alongside all active individuals kind of at any stage of their journey, but definitely see a lot of runners, a lot of CrossFitters. Those are probably our top two that we see for sure.
Gotcha. Yeah, yeah. Tend to be some injuries and discomfort with those two sports for sure.
Yeah.
Yeah. All right, cool. Well, I want to finish up here in a little bit, but I also want to talk about potential physical therapist as well. So, what should somebody consider if they're thinking about becoming a physical therapist? Do you have any advice for them?
Yeah, I would definitely say checking out some in-person physical therapy clinics. I'm biased, but I would say checking out Onward would be a great one to see kind of what physical therapy could be, but really depending on what setting people are interested in, because physical therapy has such a wide range that of places we're in and what that looks like. So definitely getting some firsthand observation of what truly goes into the day to day of whatever setting people are interested in. Definitely helpful to check out, okay, is this something that is gonna fuel me? Is this something I could be passionate about? Or is this not what I imagined? Is very important, I
Mm.
would say, at the beginning.
Yeah, those are very good questions to ask themselves as well. So, got to kind of like dig a little bit deeper and learn from other physical therapists' experience to make sure it's what you want to be getting into and being familiar with those different types of models too. Traditional physical therapy, um, the insurance-based approach versus a little bit more of like what you guys are doing. So, it's good to know all those different avenues and where which one would fit best, for them. So.
Yeah, exactly.
Awesome. All right, cool. Well, I like to close with a couple fun questions. So, first off, are there any books you're currently reading or have read that you would recommend to anybody out there that would help them with, I don't know, their lifestyle, getting them out of pain, or just functioning better in everyday life?
Oh man, good question. Should have given me this one ahead of time. I'm sure there's a bunch that
Uh,
I'll think of afterwards. I'm
My
like, oh man,
bad.
what are books?
That's my fault as the host. Shame on me.
Ah. Um, this might not be in the realm of exactly what you were saying, but one of my
Hmm.
all-time favorite books, if you've heard or read it, it is Born to Run.
Oh, okay. Yep.
Yeah.
Yep. I've read it. I used to be a runner and triathlete. I say I used to be, but I don't think I'll ever fully get rid of those adaptations because I just like so many years of that kind of stuff. But that was one of those that I read in the beginning stages where I was kind of transitioning my running technique from more of a heel strike to a little bit more of like a pose method slash midfoot strike. So that was a very fascinating read for sure. So.
Yeah.
Hmm. Yeah,
Yeah, it's an
good one.
inspiring one for sure. I feel like just kind of a little geeking out about human body, but also just reading about some very cool human feats of running and endurance. So
Hmm.
yeah,
Yeah,
that one's
definitely.
that one's one of my
Cool,
favorites for sure.
cool. And then I would say mine would be since we were talking about breathing before. During my master's, working on my kinesiology degree back in Chicago, I did a lot of breath work, education, and research for myself. But one of those books that I read was called The Oxygen Advantage by
Hmm.
Patrick McKeown. So that one was really good. It talks a lot about, de-stressing with proper breathing techniques and how a lot of people actually tend to overbreathe. They breathe too much for what their body actually requires, which can lead to involuntary like low level hyperventilation, which has a whole bunch of negative impacts on the body. So it has a whole lot of great breathing exercises that I could recommend to people. So that's one of my favorites. You should check that one out if you haven't already. But yeah. And then my last question would be, I mean, we already talked about this practical application a little bit, but if there is just one thing a listener can do starting today to minimize the risk of sustaining an injury, what can they start doing? So, some low risk, high reward, whether exercise and or stretch that they could start doing. And I'll link to it if there's a video associated with
Yeah, I wish there was that one magic stretch, right? I'm like, man, if
it.
everyone was just doing this, we'd be
Oh,
good.
yeah, I know. But yeah,
Um,
there's some, high ticket items out there that can make a big difference, but I don't know. Wanted to get your input on that.
yeah, no, I would say the magic answer for sure of that is just movement. And
Mm,
no
yeah.
one specific movement or exercise, but just getting the body moving. Our bodies are meant to move and like movement. And that might be a small, like low stress on the body movement if your body hasn't been used to moving, but just getting people love going walking first, walking, stationary bike. Just movement breaks throughout the day, I would say, is kind of my number one intervention, especially if people live a sedentary life
Mm,
and think that, oh, if I don't get my 20 to 30 minutes of cardio, then there's kind of no point. It's an all or nothing. But there's a new movement called movement snacking, where even
mm.
just getting your heart rate up for a little bit, for a little amount of time, really adds up throughout the day. So I would say get yourself moving every 30 minutes to an hour minimum, especially if you're at a desk and living a sedentary lifestyle. But that would definitely be my number one top hitter, I would say, of changing a lifestyle
Awesome.
is move.
Yeah, I love it. And it was actually an answer I was not expecting. So,
Huh.
yeah, I feel like I talk about it so much, like everybody knows about it, but no, I mean, it's not something people actually think about a lot. So, and
Yeah.
I hear movement snacks are delicious. So,
Yep.
definitely get them in.
Yep.
Awesome. All right, cool. Well, thank you so much, Kaylin. It was an awesome podcast. Love having you on. I definitely learned a lot today, and I know the listeners did as well. So, and for the listeners, I will link to everything that has a link involved with what we talked about today. I'll put your website up there so people can find you, and Instagram links as well. Or do you prefer any ones particular?
Yeah, Instagram works well. We're at Onward Las Vegas on Instagram and website, easy to find and yeah, easy to reach out to us for sure.
All right, perfect. Thank you so much, Kaylin.
Yeah, thanks for having me. It was fun.
All right, take care.